That's much better. It's better than I slipped and fell on the marble. And it wasn't a Saturday night.
What happened to Heinz? That's what happened to Heinz, right?
He was skating. His wife Mary was skating on the lift. Nice to see you.
It's always good to see you. And if you need a good nurse,
I do.
you let me know when. Are we ready to go? Is this on? Welcome all who are gathered in this wonderful establishment that this community fondly knows as Charter Oak Health Center. It is a privilege to have this many gathered officials who work very hard and tirelessly for the city of Hartford and the state of Connecticut. We're here to talk about Medicaid, Husky Health. And for some who don't understand it, it's some payment that goes out to the underserved community. For us here at Charter Oak, who 50% of our patients are covered by Medicaid, it is what gives them a future story to their life. So please, listen to the comments of our dignitaries and understand that Medicaid is a resource that we do need to continue to care for this community. And not only this community plagued by social influencers of health, but many, many residents in the state of Connecticut. It is my honor and privilege to introduce Commissioner Andrea Barton-Reeves.
Thank you. I am Andrea Barton-Reeves. I'm the Commissioner for the Department of Social Services. And as we heard the CEO, Bernadette Townsend, speak today, we're here to talk about Medicaid. My agency is the one that is responsible for administering Medicaid in the state of Connecticut, and we have just felt the being under siege around this, as every state has in the union. There's so much uncertainty that's associated with Medicaid, and today you'll hear a little bit more about that. But before we begin, I did want to talk a little bit in more specifics about what some of the things are that we're hearing. So I know that many of you have been following some of the news in the House about the recently passed resolution looking for $880 billion in cuts in Medicaid. And while we really don't know for sure where those cuts may fall, we do know for sure one thing, and that is it means real consequences for our families and our seniors and people with disabilities here in our great state of Connecticut. So in looking at some of the things that have been proposed with respect to cuts, they include perhaps a per capita block grant based on our population and income in the state of Connecticut. They may also include lowering what we call internally our FMAP, but what most know as the federal match that we get for the dollars that we spend as a state in Medicaid. In some instances, it can be as high as 90% with some programs. The average is about 50%, but it could drop as low as 25% with some of the proposals that we're seeing before us in the House budget and House proposals. There is also, as if that is not draconian enough, the possibility of just eliminating a match on the floor altogether. And what that means is that you would essentially be paying whatever it costs to administer Medicaid, and that means less care for patients and more costs for the state, without any particular formula or guarantee of the amount of money that we would get from the federal government. This, as you might imagine, is incredibly frightening and destabilizing for us and for the rest of the United States. So today we are here with our delegation from Washington and from all of our leaders to talk about what this means for the state and what we can do to make sure that we're standing up for those who really need our help and for the 1.2 million people in the state who rely on Medicaid in the state of Connecticut. So now I would like to call up, as soon as I find my order, I would like to call up the mayor of the city of Hartford, Arunan Arampalam.
Thank you, Commissioner. I want to say thank you to our federal delegation. We've got Congressman Courtney here, my Congressman John Larson. We are so lucky in the state of Connecticut to have a federal delegation that is going to fight for hardworking Connecticut residents every single day. And to our governor, our comptroller, across the state, local and federal government, Connecticut is unified in fighting for those who need it the most. And that's why we're here today. Charter Oak is one of 5 federally qualified health centers in the city of Hartford. It's a special one to me because my house is actually just a few buildings down the street. That way, for any of you who are visiting us and look around certain parts of Hartford and worry about public safety, just know the mayor lives on this street, so there's a police camera and license plate readers right down the street. If anybody does anything to your car, they'll be picked up by the time they're on Park Street. So, but we're here to talk about healthcare. And to me, this is why it matters, because I recognize that the healthcare that is afforded my family is very different than the healthcare that is afforded every other resident on this street. Just these streets right here, when you walk out these doors, these are hardworking Americans who deserve, just a couple blocks from the state capital, the capital of one of the wealthiest states in the wealthiest country in the history of the world. They deserve basic access to healthcare. I see, especially as prices have been rising across our communities, on Saturday mornings, lines out the doors in our federally qualified health centers here in Hartford of people who just want basic dental care for their kids. Who just want basic access to preventative screenings that can prevent chronic disease that has a much bigger toll on our population, a toll on our workforce that's economic and that can have a quantitative impact on the strength of a state or strength of a nation. But more fundamental than that, the basic human right of our neighbors, our friends, who need these services. And so we appreciate all the work that the Department of Social Services and the governor's staff have done to quantify the potential impacts. But beyond the numbers, these are people. These are people in our community. And if we're not here to stand up for hardworking people who need access to health care, who will be? I appreciate you guys being here. I don't know who I'm supposed to introduce up next, so I can kick it back to you. Thank you.
Trying to save Medicare and be the MC. So here we are. Next, we will hear from the State Comptroller, the Honorable Sean Scanlon.
Mayor, when you said you lived on the street, I thought you were winding up to invite us all to your house for the
You're welcome to come over.
for the after party here. But it's great to be here at Charter Oak, and I echo obviously what the mayor just said. I've been here many times in my capacity as comptroller, not just as the chief financial officer of the state, but also the person who runs the largest non-Medicaid health plan in the state of Connecticut, 260,000 people. So between Andrea and I, half the state gets health insurance through the two of us. And I'm here today really to join with her and obviously our amazing delegation, just to send a message to the president and to Congress. Don't do this. The lives that are at stake here in this state, people who voted for Joe Biden and people who absolutely voted for Donald Trump, will be absolutely impacted by this in a way that is unfathomable and that we have not seen in this country in a very long time. And as the chief financial officer, I know exactly how much money we get from Washington. It was $6.6 billion in fiscal year 2024. That's $6.6 billion that we do not have lying around here in Connecticut to meet the needs of these people. We cannot possibly replace what we have been getting from the federal government, and that is something that I think worries all of us because, as Arunan just said, the need won't go away. The need is there on this street, in every city and town in this state. 1.2 million people getting their health insurance through this, 25,000 of whom are children, 80,000 of whom are disabled and elderly, blind people. These are the most needy folks in our state. These are the most vulnerable people in our state. And obviously, we hope that, as you'll hear about from our congressional delegation in a minute, they're going to do everything they can to stop this. But the one person that can stop this is the President of the United States. And I hope that states like us and states around the country are talking about what the impact of this would be and making it crystal clear that this is the last thing that we should be funding or cutting the funding of to fund a giant tax credit or a tax cut for those that don't need it. Health insurance for these people that come to Charter Oak, that are seen at Hartford Hospital, a couple blocks up the street. These are people whose lives will literally be at stake without the health insurance that they get through Husky, and that, to us, is something that we will continue to always fight for, no matter what, between now and when this bill hopefully does not pass. And so I just would urge everybody in Connecticut to think about the stakes of this and make those intentions clear. If they have concerns about this, call your congressman, call your senator, voice your concerns, because clearly so much is at stake and we have so much to lose if this bill goes forward. So thank you very much, Commissioner.
So next we will hear from Matt Barrett, who's the president and CEO of the Connecticut Association of Healthcare Facilities. We know these as long-term care facilities. What most people may not understand, they may see Medicaid as an insurance program for people who access care here at this really wonderful FQHC and others. But a good chunk of our Medicaid also pays for nursing homes and long-term care, and the impact of this would really be devastating. So Matt, I really welcome you to come and start that conversation with us.
Thank you, Commissioner Barton-Rees, especially for inviting our participation for the very reason that you just expressed. Nationally, nearly 2/3, 62% of all nursing home residents rely on Medicaid for their care. The numbers are even more dramatic here in Connecticut, where some 73% of nursing home residents are Medicaid recipients in 195 homes. This is not surprising, as Connecticut has the 6th oldest population in the nation. Generally, New England states have older populations, and Connecticut has more people over 65 and even more over 80 than most states. In Connecticut, there is no other segment of our healthcare system that is as reliant on Medicaid as our nursing homes. 50% of Medicaid expenditures are covered by the federal government, and there has been considerable instability in the system during and now on this side of the COVID-19 public health emergency. 15 nursing homes have already closed since 2021, and several more are signaled for closure. Yet with these dynamics, there is a clear rising demand for long-term care. Occupancy is now 87% and rising, even as Connecticut is a national leader in right-sizing and rebalancing long-term care services and supports. The aging population is growing rapidly, and the demand for long-term care services is expected to rise dramatically in the coming years. And so we need to continue to expand choices in the community, and we need to preserve the supply of badly needed nursing home beds. And in that regard, we're so grateful for our partners in Connecticut state government who understand these dynamics. And in particular, I want to single out Commissioner Barton-Rees, who just last year oversaw a work group, we called it the Excess Capacity Work Group, Bed Capacity Work Group for nursing homes, that observed that as little as 60, if as little as 600 beds came out of the system, on top of the closures that we've already had, we would be 90% occupied in our Connecticut nursing homes, practically full. And just this year, Commissioner Barton-Rees has, again, with the governor's strong support, introduced legislation that would open up a nursing home bed moratorium, closed since 1991, to allow for the first time since 1991 the expansion of nursing home beds, because the commissioner gets it. We are what's signaled here is an access to care issue, and the demographics and the numbers just make it so clear. And so with that, more investment in Medicaid for our seniors is needed, not less. Any cuts to Medicaid would be a grim reality for our seniors in Connecticut, and we're so grateful once more for being invited to participate here.
So you heard Matt talk about the number of nursing homes and people who are either currently in care or will be. So to continue that conversation, I'd like to invite up Mag Morelli, who is the president of Leading Age Connecticut.
Thank you, Commissioner. Matt and I always come as a team. It's always hard to follow him. But I want to expound a little bit on what Matt said. I represent Leading Age Connecticut, and we represent the nonprofit providers of all aging services throughout the continuum. And long-term services and supports are more than just the nursing home, and we're all affected by it. We're all going to be touched by it. Whether it's our grandparents, our parents, ourselves, whether we're doing the actual care or receiving the care, at some point in our lives, we're going to be touched by long-term care services and supports. And very few people plan for it. So who pays for it? You pay for it privately. Maybe you might have long-term care insurance. Medicare is not going to pay for it. The only program that pays for long-term services and supports for the elderly is Medicaid. And in Connecticut, we have a wonderful, robust program of long-term services and supports. So we have people that are cared for in the nursing home, but 70% of the people who are cared for through the Medicaid waivers, through the Medicaid program for long-term services and supports, are receiving their care in the community, in their own homes. These are people that need a little support or maybe a little more support to be able to maintain their homes in the community and live their final years of their lives, use it with the support of the Medicaid program. These are people that have worked all their lives. These are people that have cared for us, raised their family, taught us in school, right? Fought our wars. These are people that have worked all their lives, and now they need some little assistance to continue their lives, some supports and services, and that's where the Medicaid program comes in. Our home care program for elders, which is fabulous, is considered in Washington to be an optional Medicaid benefit. And so that has an even bigger target on it. Nursing homes are a mandatory benefit, but community-based services are optional. So we are begging Congress and the President to maintain our Medicaid program so that the older adults in our state can live with dignity, live their lives in the community or in the nursing home with the quality care that they deserve and they need. I mean, who are we if we turn our backs on the people that cared for us our whole lives? So thank you for having us here. We really appreciate the opportunity to raise this issue so people are aware of how important Medicaid is to our older adults in the state. Thank you.
So next, I'd like to introduce two members of our federal delegation. These are the gentlemen and the women who have been on the ground fighting the fight for us in Washington against the draconian cuts that are being proposed. First, I'd like to ask Congressman John Larson if he would come and say a few words.
Sure. Well, thank you, Commissioner, and it's an honor to be here, and I especially want to commend the governor, and I also want to commend William Tong for the incredible work that they are doing. It's the states, it's the legislature, it's our constitutional officers, it's the mayors across this nation who are going to make a difference. Our delegation stands united in this fight, and so do the Republicans. You may have witnessed that at our so-called State of the Union message the other night, where the president articulated again what they intend to do. I can go through the numbers, but you know the numbers. The mayor said it best. It's about the people who live right outside of this building. That's what this is about. It's about people and the impact these programs are going to have on them. Donald Trump and Elon Musk will not miss a moment's sleep last night, tonight, or the next night. Billionaires simply don't understand, nor frankly do they care about the very individuals that the commissioner addressed and spoke about. And yet, as a nation, as communities, and as a state, we're called we the people for a reason, because we are. And so that's why this delegation is standing together to prevent these unbelievable cuts. And let's be clear about this. Why $2 trillion? Why did Donald Trump appoint someone who did not have to be confirmed by the Senate, who's not a federal employee, not even a volunteer, has no accountability, and has been given the assignment to come up with $2 trillion? Is it because of their overwhelming concern about the national debt, and this is what they want to make sure that they're going to address? Or is it about making permanent the tax cut of 2017 that was, $2 trillion, 70% of which went to the nation's wealthiest 1%. Of all the programs of the federal government, and 70% of that federal budget is made up of defense that Joe Courtney knows more about than any member of Congress, Medicare and Medicaid, and Social Security. And of those, the only one that has a trust fund, that actually has money sitting there in a separate, untouchable trust, is Social Security. It has $2,800,000,000,000. They have their eyes focused on the money. That's where they are going. That's what they are focused on. They are out to privatize the system. When you hear Musk talking about it, believe what he's saying, because that's exactly why he can't be held accountable. We just had a press conference the other day about bringing them before Congress and saying to our Republican colleagues, we want them in front of us as a democracy to answer the question as to why they need the documents from Social Security and Medicare and Medicaid. What possible use do they have for people's private information like that? Everyone in this nation should be as outraged as our delegation and as I know the governor and William Tong and the constitutional officers, our General Assembly, and mayors and selectmen all across this state are. And with good reason, because the nation is under assault. And that's why we have to bring this to the public's attention. And everybody needs to get on the phone and call. The media has never been more important to our nation than now. And at a time when media is going through great change and where most people rely on social media to get their information. And so therefore will believe the bold-faced lies, let me repeat that, bold-faced lies that come out of this administration. This is the time to speak truth to power. This is the time, thankfully, that we have governors that are calling upon red state governors and an attorney general that's taking the lead across the nation to take this administration to court and hold them accountable for their actions that will impact the very people we take an oath of office and are sworn to serve. Thank you, Commissioner, for holding this press conference. Thank you, Governor and Attorney General Tong, for their incredible work. We stand with you. We will work as hard as we possibly can. In the House, we need three Republicans who will stand up for the people they represent. Every state, red or blue, has Medicare and Medicaid and Social Security. They're all on the firing line. America needs to stand up. Thank you.
Congressman Joe Courtney, please.
Great. Thank you,
Yes,
Commissioner.
thank you.
So, good afternoon, everyone. I want to first of all thank Burnett and the Oak Hill team for hosting this here today, because federally qualified health centers are, actually right in the crosshairs. You provide primary care, behavioral health, dental, whole host of other things, and Medicaid is the workhorse in terms of making sure that the doors stay open and the lights stay on, because your mission is to treat people regardless of ability to pay. And Deb Poulin is here as well, who heads up the state association. We obviously have great members out in Eastern Connecticut, and again, it's in Eastern Connecticut we actually see Navy sailors coming through the doors there, because sometimes the TRICARE program struggles in terms of pediatric care. So, I mean, again, it's a broad swath of our nation's population, our state's population, and would be just devastated by what's being proposed. Again, Medicaid is the largest healthcare program in America. It's bigger than Medicare. There's no private health plan that even comes close in terms of the size of it. We've heard from, Matt and Meg about the fact that our oldest citizens rely on it in terms of long-term care. But the fact of the matter is 50% of live births in this country are covered by Medicaid. It's about 41% in Connecticut. And if you look at older populations, Access Health, which again helps young adults get coverage. And again, Medicaid is part of that system that, again, we've done great work in Connecticut in terms of expanding eligibility and enrollment that's here. Opioid addiction, if you talk to any of the providers that are out there, again, Medicaid is, again, the workhorse in terms of making sure that dealing with the scourge of addiction and fentanyl, and it's just, again, that Medicaid is it in terms of just keeping those programs alive and moving along. So, I was sitting next to John a couple nights ago, and he was, being pretty laid back and pretty cool. And then Trump started talking about Social Security, and it was like, we saw the Irish, come out, but the fact of the matter is, a week ago last Tuesday, as was said, it was a 217 to 215 vote. We actually thought we had it because there were 3 Republicans at that point when they were sort of whipping the vote that were not going to vote for it. The speaker sent us off the floor. He had said, we're done for the day and we're taking it up. 15 minutes later, 2 of them switched. And we all scrambled back on the floor, and again, it passed by that margin. But if you listen to the debate that took place that day, one of the ways they were able to convince their members that it was okay to vote for this, and Scalise and Speaker Johnson, was like, Medicaid's not even in the bill. You can't even find the word Medicaid in the bill. And technically, they were right. It was a resolution that set up the numbers. So John's committee, Ways and Means, is going to have to deal with a $4.5 trillion tax cut, almost all of which is, again, for that top 1%, which is just, enormously expensive. By the way, no repeal of tax on tips, which the president campaigned on, no repeal of tax on Social Security payments that are there, again, which shows just that all these promises they're just willing to throw overboard. But the one they're not is the tax cut for the top 1%. So his committee is going to be now having to flesh out what was just really sort of a bare bones resolution in terms of the tax side. But the Energy and Commerce Committee is the committee that's going to be dealing with the Medicaid cuts. Again, 2 nights ago, the Congressional Budget Office issued a letter which, again, just totally ripped the curtain aside and said there is no way that you can hit an $880 billion savings in that committee's jurisdiction without gutting Medicaid. I mean, this is now, the next vote, there's just not going to be any way for people to hide in terms of just, what exactly we're doing. And that's going to be the gut check moment in terms of just, where it's not even just what's your policies or it's what your values are, in terms of as a person, in terms of taking that vote. And again, it was very close first time around. As I said, this one's going to be harder, and that is definitely well understood in the chamber that's there. And with the external pressure and the external noise, which we're doing here today, is the way that you create the environment for us to prevail on this point. And that is not just happy talk. If some of you remember, when they tried to repeal Obamacare, one of the components of it was, again, just gutting Medicaid. When that debate started, most people said, you know what, Medicaid, that's just, that's sort of the poor cousin in our healthcare system. There's no political sort of support for it. But over the course of the debate, the noise grew louder and louder because of hospitals, nursing homes, community health centers, individuals that were coming forth. And as you may recall that dramatic moment, when the moment of truth and the gut check took place in the U.S. Senate, John McCain walked out onto that floor and gave a thumbs down and killed repeal of Obamacare. We can do this. The margin in the House in 2025 is closer than it was in 2017. Paul Ryan had about a dozen votes that he could just sort of give away and still get a bill through. Mike Johnson can't do that, okay? And Again, we got to keep telling this story and reminding people that, this isn't just for people who want to work or whatever, whatever sort of smear they want to put out about the Medicaid system. This is about children at birth all the way through the end of life and everywhere in between that's going to be damaged and harmed and hurt by this proposal that, again, they barely passed a week ago Tuesday. So we got to keep it up, and we got to just, again, keep repeating this message and getting the word out to the public. And it gets picked up not just in Connecticut, but outside of the borders of our state. So it's not just sort of a echo chamber here of us talking to each other. We've got to create that noise from coast to coast. Thank you for letting us be here today.
And finally, I'd like to introduce the great leader of our state, the Honorable Governor Ned Lamont.
Thanks, Andrea. Yeah, Joe, we just need 4 John McCains to come in and do this. Is there a little profiling courage? We need you. Look, when you need health care, you need health care, no questions asked. I busted my wing a week ago when I went to the Charter Oak of Mumbai. And no questions asked, they took care of me. And that's a deal we have with our people. We take care of each other, especially when it comes to health care. And that starts with a partnership with the federal government. And the federal government is breaking what's been a partnership going back, generations at this point, what you can count upon. When Andrea says, $880 billion, you go, boy, that's a big number. And then you divide by 10, it's over 10 years, it's $88 billion. Then you say Connecticut is 1% of the population, that's $880 million. That would hit our state virtually overnight. I don't know how they're going to do it. Are they going to block grant Medicaid, which means any inflation increase that's paid for by us? Are they going to cut away the subsidies on covered Connecticut? That would mean those folks on covered Connecticut, instead of having maybe $50 a month, it'd be $2,000 a month. They're going to cut back on expanded Medicaid and all the support that gives for people who otherwise won't be able to get by. We don't know. And that unpredictability is hell for people's confidence. The business community has no idea what's going on down in Washington, D.C. That's why they're stopping investing, and that's why you see markets slowing down. That's why you see economic growth slowing down. Governors across the country, I talked to red state and blue state governors. We've got our budgets more or less in balance. We're ready to go. We have to have some idea what next year is going to bring, and we have no idea. And by the way, Doge, you're not saving anybody any money if all you do is push costs onto the states. That's not Doge, that's a Dodge. And that's what I'm afraid a lot of these folks are doing right now. If that's $880 million, what then? You say, oh gosh, I'm going to cut off some people and so they no longer have access to Medicaid. We're still taking care of those people. They're going to be coming into a clinic just like this. They're going to be going to a hospital. It's called uncompensated care. Hospitals get hit by this. Federally qualified health centers will get hit by this. I've been talking to red state governors. What is this going to do to your rural hospitals? It will eviscerate them. So I'm trying to get 3 or 4 John McCains who are able to do this. I got to say, we have an amazing delegation down there in Washington, D.C., and John and Joe are taking a lead there. What you can do across the aisle to make a difference. I'm trying to do this, every day with my fellow governors. Right now, they're all a little gun shy. They're a little worried, the Republicans, terrified of a primary. You mentioned primary, and they run for the hills. But this is where, when you cut bureaucrats, it sounds sort of easy. That's where we are right now. When you're cutting people's basic health care, you know what that means when you need it. And that's what I worry about right now. So I need everybody to speak up with one voice and tell people what it means. I want to thank each and every one of you. I want to thank you for what you do on behalf of the folks here. Otherwise, would have no place to turn.
On-topic questions? What should Connecticut legislators be doing right now? Should they be exploring ways to cut Medicaid, looking for how to expand it, or is this discussion premature?
I think it's premature. I mean, honestly, no, because, so the resolution passed last week. It goes to the committees, before it goes to the committees, the Senate has to pass a concurrent resolution, which, at this point, there's actually disagreement between Thune and Johnson about how that's supposed to look. But assuming they do it, it's still going to be probably end of March or April. And You know, assuming they are able to do that, then it goes to John's committee, it goes to Energy and Commerce, it goes to, you know, actually, some of it's coming to Armed Services that are there. So they've all got to do their thing, and then it's going to get brought to floor votes. So, I mean, I just don't think that, you know, I mean, I'm not telling anybody how to do their job, but at this point, it is still very fluid, and it's very kind of murky in terms of just, you know, how this is all going to shake out. And again, while this drumbeat is hopefully happening, you know, going to Republican members as well, to Ned's point, they actually have higher Medicaid dependency than a lot of blue states like Connecticut. You know, again, I think it's far too soon to put up the white flag.
Governor, what are your thoughts? You kind of reminding everybody today what the stakes of the game are. When do we begin the discussions about if we have to deal with a loss in money? What happens? Do optional programs like dental and pharmaceutical go on the table? Do we just say, no, nothing optional goes on the table, we'll deal with it all with revenue? When does that discussion start?
We're modeling out as many of these eventualities as we can. You know, as Joe said, you know, you can't sit around imagining the worst every time. Every time Donald Trump says something, you can faint and then get up again. But we're thinking carefully. If there was a 10% cut, if there was a block grant, what do you do with Covered Connecticut? What does that look like in year one? What does that look like over a few years, and how do you manage that? We're modeling that out right now to see what those consequences could be. I don't think there's any way the taxpayers of the state of Connecticut can make up all the shortfall, but I think we've got to do everything we can to help the people most in need. Anything else?
No, Governor, that's right.
Are you, oh, sorry, no, please go ahead. Are you seeing any changes in the care so far with the uncertainty of funding right now, just in, like today?
No, we're not, fortunately, we're not seeing any changes in care. What is really remarkable about the providers in our Medicaid network is that they are just so deeply committed, and I think as worried, if not more so, than we are, not really about themselves so much, but about the people that they care for. And there are very few states, I think, where, you know, as small as we are, we can really say that about every provider, but there hasn't been a provider group that I've heard from that has said, I'm really worried about my ability to be able to care for the people who come to me every day. So that's really, I think, just a testament to who we are as a state and the commitment of the providers who are serving our Medicaid recipients in Connecticut.
And Commissioner Barton Reeves, last week, or that was actually earlier this week, you said that work requirements were the most, you thought that that was the most likely outcome. This is to the federal delegation as well. Do you all take Speaker Johnson at his word as of now that he won't block grant the program, that he won't lower the federal match?
They'll do whatever Donald Trump tells them to do.
That's right. Yes.
And the fact that if you look at the savings for work requirement, which again is a totally a dud in some of the states that have done it, it doesn't even come close to the magnitude of the cut that they're talking about. So they have to go much deeper and harsher, you know, to sort of meet that number that came out of the budget resolution. And again, we still haven't heard from the Senate yet, and those guys are getting, you know, definitely pretty squirrely because of what they're hearing from back home.
And let me be really clear about sort of the philosophy behind work requirements, right? It's this really wrong-headed assumption that people who are on Medicaid or receive some kind of support just simply aren't working. That isn't true. We know that in this state, 78% of the people who receive Medicaid, they're working. And other people who are not working, they're caring for other people. So this idea that we can just shed the roles of all these people who are, you know, who are doing no good and just sort of sitting around waiting to collect something from the federal or state government, it just simply isn't true. We have so many working poor people in this country, and to be able to wrap our heads around that reality, I think is very difficult for some, as our congressmen have said. But that is really the truth of it. So that's why, in many instances, work requirements haven't worked in other states, because it's incredibly expensive to implement, and it really is, it's antithetical to this misperception about people who actually receive Medicaid.
Could the governor or Andrea tell me, what does OPM think we're looking at if we just get hit with a block grant? What type of a loss over the next 5 or 7 years are we looking at just with block granting?
these guys know better than I do, but if we're going to stay with the fiscal '24 numbers and they want us to anticipate that through, say October 1st, then you have to put in some quotient for medical inflation. And they're going to start pushing all that medical inflation on the backs of the state taxpayers.
Do you have any idea, Governor, what that erosion looks like in terms of numbers?
Any thoughts there?
Yeah, we do. So again, as the governor said, and as Congressman Courtney said, it's really premature. But for example, if we were to take a look at reducing our federal match for Husky D, so that's our expansion population as an example, which is now at a 90% match. If that were to go down to a 50% match, we would be looking at a cut that's about $950 million, right? So that's not something that we think that we could make up.
I hear you, Commissioner, I apologize. I wasn't talking about the federal match and the 50%
Yeah,
floor. I was talking about just if we have block granting.
I'm
what
sorry.
type of- No, I wasn't clear.
Oh, you were just talking just about block granting?
granting.
Okay, all right.
How toll that might take in the coming years.
Yeah, let me see. So we have our per capita spend and our block granting. Don't know if I have that specific number with me. I can get that for you. Okay.
Thanks, everyone.